Hello students, welcome to KENE'S Educare, a group of KENE solutions. This is part 9 of lesson number 13, Why Do We Fall Ill? So as you all know that in part 8 we discussed in detail about tissue specific and organ specific manifestations, right? Where we discussed in detail how exactly the bacteria is going and affecting your tissues, and they're going and affecting your organ, because of which the organ system is not able to perform its specific life process. Like if I say lungs, we know that lungs is like if any bacteria is entering through your nose or your mouth. Okay, like if suppose the bacteria is entering through air, then it is going to enter through your nose, and like indirectly it's going to reach lung. So over there your lungs will get infected. So the organ targeted over here is your lungs, and the person who has been targeted like this can have pneumonia, right? Then if it's going through food, it can affect a different organ of your body, right? And then on the basis of that, people can have typhoid. Then if it is through mosquito bite, it can like cause malaria, dengue, right? Because this bacteria, viruses and protozoan, it can be anything, right? But the way through which they are spreading, and they are like after spreading they go and target your specific tissue or organ of your body. Okay, because of which, like as I told you, the organ system finds it difficult to perform that specific life process, and this is how your immunity will become weak, and like you suffer a lot there, right? So immunity is a very important concept. Maybe we'll study that in the next part, because I thought of completing principle of treatment and principle of prevention in this part, and then in the next part I will be completing with immunization, summary, and then the 6 basic questions that we have for the lesson. So this is what the plan is, so that in the next part we are completing the whole lesson. Okay, so before I proceed with this part, I want each one of you to please revise the notes that you have made starting from part 1. I want each one of you to revise each and everything that we have studied from part 1 till part 8, because that is what is very important for you, right? I hope you all are revising each and everything. I want you all to revise each and everything that you have studied. Okay, because the notes that you have is very important with you. That is going to help you in the last minute as well. Okay, so make sure you all are revising it. After this, like, I'm going to show you all the slides one by one, and I want you all to have a quick revision on the significance of health, and now you know what kind of revision you need to have, right? I hope you all are going through the significance of health, because over here, like, this was the first time where you actually knew that it's not that going to gym, hitting the gym every day, and do, like, being physically, you can say, active is going to make you healthy. No, you can't. Okay, because unless and until you're not mentally and socially, you can say, mentally and socially, you can say, healthy, your mind is not relaxed, you're not socially active, you can't say yourself healthy, right? So that thing started from here, the significance of health. And after that, we discussed on personal and community issue. Both matters for health. Your personal life is going well, but there are so many community issues that you're facing in the environment that you live, in the atmosphere that you see, right? So both of the issues, they matter for health, and over here we have discussed that itself, right? So I want you all to please go through it quickly. After this, personal and community issue, as we know that both matters, right? After this, we discussed on the 5 F's, because you maintaining the personal hygiene and everyone around you is living in that particular environment, and maintaining a personal hygiene in that environment is equally important, right? So please go through this 5 F's as well. After this, we discussed on distinction between healthy and being disease free, because both the terms are different, right? You being healthy and disease free are two different things, right? So I want you all to please go through this slide quickly. I hope you all are going through this slide. After this, after studying the distinction between being healthy and disease free, the next thing that we discussed was disease and its causes. So under this we discussed on like what does disease look like, right? So I want you all to please go through this slide as well. After this, like after discussing on what does disease look like, we discussed on the signs and symptoms. So like you should be knowing this point as well, like what exactly is like are the signs and symptoms, okay? Then the next thing that we discussed was about the acute and the chronic diseases. So I want you all to please go through it. Now, writing about the acute and the chronic diseases is very simple because you know that acute diseases they last for a very short time, whereas chronic diseases last for a very long time, right? So please go through it along with the examples. After this, we discussed on chronic diseases and poor health. So please go through it. quickly. See, we have already discussed how chronic diseases like ultimately will lead to poor health, right? So make sure that you will be able to write a brief note on it as well. So for that you need to have like for that you need to keep on revising this part. Okay, you can even add your additional stuff, like if you have other points that you want to write, you can even write that, but make sure whatever you're writing, it goes on with the like co- topic that you're writing, right? Because the topic should match, and whatever you're writing under that should be compatible with it. Okay, so I hope you all are going through this slide. After this we discussed on causes of diseases. So I want you all to even go through this. So over here we have all the three reasons why exactly the diseases have been caused, right? So I want you all to please go through it as well. Then we discussed on the infectious and the non-infectious causes. So I want you all to please go through this as well. Then we discussed on some of the infectious diseases which have been caused. That is smallpox, measles, herpes, swine flu. Okay. So after that we discussed on the infectious agent, right? And I want you all to please go through it quickly. Then over here we discussed about the SARS virus, the Phylococci bacteria, which causes acne, and trypanosoma, which is a protozoan responsible for sleep sickness, right? So I want you all to please read it once. Then we even discussed on leishmania and roundworm. So I want you all to please go through it as well. Then we discussed in detail about the diseases, how exactly they spread, and on the next slide, we'll discuss about antibiotics, right? So I want you all to please go through this slide. Then we discussed on means of spread of disease, like how exactly they spread, right? So I want you all to please go through it quickly. After this, we discussed on the HIV and AIDS, how exactly they have been crossed, right? So they have been caused. So I want you all to please go through this slide as well, everyone. So we know that mosquitoes are like one of mosquitoes act as a vector, right? Because they are also responsible for transmitting the diseases in us, right? Then we discussed on the organ specific and tissue specific manifestation. So I want you all to please quickly go through this because we need to start with principle of treatment and principle of prevention, right? So please revise it quickly, everyone. So I hope every one of you are revising it. Now, after this organ specific and tissue specific manifestation, the next thing that we need to discuss, like over here we had so much important points which have been given, so I won't skip it. Please revise it quickly, everyone. Now we need to discuss on the principle of treatment. See, what are the steps taken by your family when you fall sick? Now, when you fall sick, your mama gets scared. Like then she will start bringing the medicines that she has, right? If you get sick in like during the afternoon time or like during the night time, what she'll do, she'll try her best to cure you, right? And like, have you ever thought why you sometimes feel better if you sleep for some time? And she will be behind you, just go to sleep, you'll feel better, right? So there is some reason, right? Why do we go to sleep for that? So when does the treatment involves medicine? And based on what we have learned so far, would it would appear that there are two ways to treat an infectious disease. Okay, how many ways? We have two ways to treat an infectious disease. Okay, so one will be to reduce the effect of the disease and other to kill the cause of the disease. So the first one that has been given, that reduce the effect of the disease. So it can happen when you just sleep or like you take rest and you feel better, right? So in that case, you're reducing the effect of the disease. Okay, that is one of the thing that can be done. Other thing is, you can kill the cause of disease, why the disease was caused. We can even kill that. Okay, so that can be done. And for the first, we can provide treatment that will reduce the symptom. Okay, so like you will be provided with a treatment which is going to reduce the symptom. And the symptoms are usually because of inflammation. So the doctor will provide you with some of the medicines that can reduce the inflammatory part, and that is how it can be cured. Okay, so for example, we can take medicines that bring down fever, reduce pain or lose motion, and we can take bed rest so that we can conserve our energy, right? What we do, we totally get on bed and we take rest for few hours so that like what we are actually, you can say, getting rest, that we are safe conserving our energy and we become well, right? So this will enable us to have more of its value on healing. But this kind of symptom, like symptom directed treatment by itself, will not make the infecting microbe go away, because your infecting microbe is still in your body, right? So it will not let your go, it will not let it go away, right? It's still in your body, it's just that you have suppressed the effects of it. So for that, we need to kill the microbes in our body. What do we need to do? We need to kill the microbes in our body. So now the question is, how do we kill the microbe? One way is to use the medicine that kills the microbe, right? What we need to do? We need to use such medicine so that it's killing the microbe in our body, okay? So they can be, we know that microbes are classified into different types, right? We have bacteria, we have viruses, we have protozoans, right? So we need to kill them by identifying them, as we studied that antibiotics can cure bacterial diseases by breaking the bacterial cell wall, right? Because once the cell wall is broken, the bacteria becomes very weak and it becomes easier to kill that bacteria, right? So they are viruses, bacteria, fungi or protozoa, and each group of organism will have some other essential biochemical life processes which is peculiar to that group and not shared with the other. Okay, so that will help over here. Then this process may be pathways for synthesis of new substances, okay, or respiration, and this pathways will not be used by us either. We won't be using this pathway because all the medicines, they have different pathway and different mechanism by which they kill the disease, they kill the microbes in our body, right? So for example, our cells may make new substances by a mechanism different from that used by a bacteria. So it can happen in many cases where our cells are using, like they are making many new substances using different mechanism that has been used by bacteria, and now we have to find a drug so that the bacterial synthesis pathway will get blocked. And once the bacterial synthesis pathway is getting blocked, we can control that microbe. Okay, so one reason Why making antiviral medicines is harder than making antibacterial medicine is that viruses have few biochemical mechanisms of their own. So this viruses, they will enter our cell and they will have their own machinery to carry out that life process, because of which it becomes difficult to make this antiviral medicines. Okay, so this means that there are relatively few virus specific targets to aim at, right? Because viral medicines, they are harder, but we have only few virus specific targets. Virus is not going to target different parts of your body, they can target only few parts of the body. Okay, so despite this limitation, there are now antiviral drugs. For example, the drug that keep HIV infections under control. So we are doing like the researchers are doing the research work and coming up with some or the other solutions to it, but till now this is what we are following. Okay, so I want you all to please write all the important points from here, and I'll have to stop over here today. So I'll continue with the next part, like principle of prevention in the next part. It's very easy, don't worry, you will easily understand it. I hope you all are writing all the important points. So in the next class, I'm going to start with principle of prevention and immunization. So we are just left with this two parts. So after discussing these two parts, I will be doing the summary discussion, and then at the end, like we have 6 different questions to discuss. I'm going to show you the questions, or like all the questions. Please go through those questions quickly, everyone. So this is how we will be ending up with the whole lesson. Why do we fall ill? And I hope whatever we discussed today in this part of the lesson, every one of you are clear with that. Now the rest of the part which has been left, I will be continuing that in the next class. Thank you everyone.